If you have a chronic medical condition and you're eligible for Medicare, you may be eligible for a special type of Medicare Advantage plan called a C-SNP, or Chronic Special Needs Plan. It's one of the few types of special needs plans available. We're going to go over the details in today's video. Hi there and welcome to our channel. My name is Sarah and I'm here today with iHealthBrokers. At iHealthBrokers, we are licensed health insurance brokers. We're licensed nationwide, so if you have any questions whatsoever, please feel free to reach us in the comments below, or you can give us a call at 888-410-0344. There's absolutely no charge for our services. Also, please make sure to take a look around our channel for any other Medicare-related videos that may help you out. We do release these videos on a weekly basis, so make sure to subscribe to stay up to date. And of course, please make sure to like this video. Liking this video will make it more visible to others who are looking for the same type of information. And we want to get this information out there. Health insurance and Medicare is confusing, so we want to make sure that our viewers and our clients are as informed as possible. C-SNPs are a type of Medicare Advantage plan. Medicare Advantage, also known as Medicare Part C, actually replaces original Medicare entirely. So you're going to give up access to that extremely broad original Medicare network in favor of additional benefits, set copays, and out-of-pocket limits. C-SNPs are a type of Medicare Advantage plan, and the benefits are specifically tailored to meet the needs of your condition. For example, let's say you're enrolled in a C-SNP because of your diabetes. Well, ordinarily a copay for a specialist might be $20, but you might have a $0 copay for an endocrinologist or a podiatrist or a cardiologist because these are specialists that you need to see more frequently due to the nature of your condition. Or if you suffer from some type of chronic lung condition, you might have reduced copays to see a pulmonologist or a cardiologist. You may have reduced or entirely waived copays for medications that are commonly prescribed to treat your condition. You may even have access to additional benefits like wellness programs and exercise programs. Like all Medicare Advantage plans, C-SNPs are offered by private carriers, so the benefits and the prices can vary quite widely. But what's important to remember is that C-SNPs specifically are tailored to your condition. So you may actually find it more cost-friendly to enroll in a C-SNP because the benefits that you're going to take advantage of more frequently are offered at a reduced rate. Of course, Medicare Advantage in general can be a little bit confusing. That's why we always recommend working with a broker to make sure that you're getting the right coverage to meet your needs. Additionally, and this is a disclaimer we throw out there with all Medicare Advantage plans, because you are giving up access to that original Medicare network in favor of a smaller network that's dependent upon your carrier, please make sure that whatever plan that you choose, that the specialists, hospitals, and doctors that you plan to visit accept your plan. In order to be eligible for a C-SNP, you must first be eligible for Medicare, and then you have to meet certain criteria that will be set by your plan dependent upon your condition. You're eligible for Medicare if you're over 65 and a U.S. citizen, or are over 65 and a permanent legal resident who's lived in the United States for at least 5 years. You're receiving Social Security or railroad retirement benefits, or you've worked long enough to be eligible for those benefits, even if you're not collecting them yet, so that would be 40 quarters. You're also eligible if you're over 65 and you or your spouse is a government employee or retiree who has not paid into Social Security, but who has paid into Medicare payroll taxes while working. That just means a Medicare-covered job. Now, if you're under 65, you may still be eligible for Medicare. If you've received at least 24 months of disability, they don't have to be consecutive, or if you have ALS, or if you have end-stage renal disease, then you may be eligible for Medicare even if you are under 65. Now, to be eligible for a C-SNP, of course, you have to have one of several chronic medical conditions. The list is pretty extensive, and I will put a link to the page where you can see exactly which conditions qualify in the description below. Let's just take a quick look. We're now on cms.gov. I'm going to put a link to this exact page in the description below so that you don't have to go looking for it. But basically, this page is just going to detail the specific chronic conditions that may make you eligible for a C-SNP. So there are 15 chronic conditions that may make you eligible. You have chronic alcohol and other drug dependence, autoimmune disorders, and then if you'll notice, some of these conditions have boxes here. So it's specifying which disorders under the category of autoimmune disorders or cardiovascular disorders, etc. So number 3 would be cancer. 4 is cardiovascular disorders, chronic heart failure, dementia, diabetes, end-stage liver disease, end-stage renal disease, severe hematologic disorders, HIV/AIDS, chronic lung disorders, chronic and disabling mental health conditions, neurologic disorders, and stroke. Again, I'll put a link to this exact page in the description below so that way you can take a look, but those are the 15 basic categories. Like with any special needs plan, you'll need to provide specific documentation. Now, you can begin the enrollment process perhaps without the documentation, but generally speaking, you'll need to provide it within a month, otherwise you risk being dropped by your plan. Generally speaking, your doctor will need to fill out some paperwork containing details regarding your overall health and the specifics of your condition. Of course, this varies from carrier to carrier and plan to plan. Like all Medicare Advantage plans, you can enroll in a C-SNP during certain times. Your first option is, of course, your individual open enrollment period. This is the 7-month period surrounding your 65th birthday. So it's the 3 months before your 65th birthday, the month of, and the 3 months thereafter. You can also enroll during the annual enrollment period, which is annually. So it's every year from October 15th to December 7th. And then finally, you may qualify for a special enrollment period. So I said this earlier, but it definitely bears repeating, that C-SNPs are a type of Medicare Advantage, which is Medicare Part C. Medicare Part C replaces original Medicare, so you're giving up original Medicare in order to enroll in a Medicare Advantage plan. This means that you are giving up access to that extremely broad original Medicare network, because most doctors and hospitals, it's estimated somewhere around 93%, accept original Medicare. That percentage is much, much smaller when we're talking about specific carriers and plans. And most Medicare Advantage plans are HMOs. Of course, there are some PPO options, but most are HMOs, which means that your doctor, your specialist, your hospital must accept your specific plan, your specific carrier, in order for you to receive coverage. Otherwise, they're not going to contribute to the cost share. So please, 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 if you enroll in a C-SNP, make sure that your doctors, hospital specialists accept your plan. You can view all of the available plans on Medicare.gov, that's Medicare.gov, by accessing the Plan Finder. Of course, you can also call the insurance carriers directly and work with an agent. This is not something we'd recommend. Number one, it's a lot of legwork because you're going to have to call each and every carrier. Additionally, an agent is a representative of the carrier, which means they can only talk to you about their carrier's plans, which may not be the best plan for you. That's why we recommend that you work with a broker. A broker works for you, not the carrier, and many do so at no charge. There's no charge for our services, so if you'd like our help, you can reach us here at iHealthBrokers at 888-410-0344. And yes, we are licensed nationwide, so no matter where you are, we can help. Of course, if you have any questions whatsoever, please feel free to reach us in the comments below. Or if you're enrolled in a C-SNP and it's going well or it's not going well, let us know because we'd love to hear from you. And as always, please make sure to like this video, that way we can get this info out there, and subscribe because we do release these videos on a weekly basis. Thank you so much. Have a great day. Bye-bye.